myself here and there. Okay. So, Franklin, Miss Franklin, I am going to go wash my hands and make sure your door is closed, and I'll be back. Okay, so I performed hand hygiene. I put on my gloves, and I make sure all of your room doors are closed and your curtain. Okay, so I'm going to start the assessment from the top, moving on down. Okay. Okay. Okay, so I'm going to pull. Can I pull your gown down? Okay, so I'm gonna pull the gown down and cover the rest of you for privacy. How do your breasts feel? They feel heavy. Well, that's because of the breast milk and the colostrum is filling up in your breast. You are going to get a heavy feeling. Okay. So yes, you're gonna get a fullness and a heaviness due to the colostrum and the breast milk that'll be filling your breast. Okay. It looks to me like your breasts are basically symmetrical, but one is slightly larger than the other, which is completely normal. The condition of the breasts seem normal. There's no discoloration, no orange peel appearance. They appear smooth. Color is the natural skin tone. Is your natural skin tone, right? Okay. There are a few stretch marks there, but that's to be expected with growing, when your body is growing, especially when it's making a baby. Trust me, I have more stretch marks for the both of us. Well, enough stretch marks for the both of us. Okay, I'm going to take my gloved hand. Excuse me. I'm going to take my gloved hand and feel for coolness or hot to the touch. Your breasts feel cool. No warmness. Being hot to the touch can indicate infection, which it doesn't feel like you had. Okay. Upon assessment of the nipples, it looks like you have everted nipples, which are nipples that stick out, which are perfectly normal. All of the types of nipples can facilitate best breastfeeding, so you will be okay as long as baby has a good latch. And it seems to me that in earlier feedings that he does have a good latch. There are no bruises. Suck marks, no trauma to the skin, no cracks, bleeding. All of these can indicate a number of things, including a bad latch for baby. So if there is a scarring or anything that occurs, you need to you really should inform your doctor or your nurse. Next time that you do decide to nurse, if you don't have a good latch, I need you to call me so that I can tell you, so I can see how you're latching and help you latch properly. Okay, so we're gonna move down to your uterus, which should be midline, which it is. What? Okay, hold on. Sorry about that, Miss Zeta. I have to film this while my kids are home. Here, go ahead, sir. Go ahead. Okay, so I'm gonna feel for your palpate your uterus, which is midline. Okay. Son, Kai, can you please get Kai? Can you get him a bag of chips, please?
There's barely any more.
Bundle check. Fundus feels firm.
There's no more. Mom, there's no more.
Okay, no more chips, dude. Okay. Uterus is firm. And it is midline, which is right where it's supposed to be after you just had a baby. So, like the level of the belly button. It's not distended. If it was, that I would ask you, do you have to go to the bathroom? Mom, do you have to void at this time? No? Okay. Right now I'm going to check your bowel sounds. Normal bowel sounds. You had a vaginal delivery, so any C-section procedures don't count. Don't apply. Um, Mom, when was the last time you had anything to eat or drink? Roughly 13 hours ago. Okay, well, we're going to work on getting you something to eat. You need to intake food to help you breastfeed, and you also need to eat, for the betterment of you. I understand that your body just went through something really physically different, but in order for you to take care of baby, you got to take care of you, and you need to eat some. Okay. So, Mom, what I'm going to do is move you up in the bed, lift you up a little bit, and then I am going to check your bleeding from birth. Kai, no more. No more. Okay. So I'm going to check your lochia and check your perineal area. I'm going to cover you here and expose you here, and then when I'm done, I will have you all covered up. I understand this is kind of invasive, but it's necessary. Okay. Upon inspection, it looks like you have the lochia rubra, which is going to be a brightish red, and this is the first blood that you see after you give birth, which is perfectly normal. Your first 3 days is going to be bright red, then after that it's going to be lochia serosa, which is dark red, and lochia alba is a yellowish, whitish discharge type. Okay. When was the last time your pad was changed? 30 minutes ago? Okay, that's not too bad. Hold on, let me check the pad. Yeah, 1 second, Mom. Sorry about that, Mom. Just... Okay, so you said that you got changed 30 minutes ago. Okay, that is a light amount of blood, which is good. Means that you don't have to be, well, your pad does not have to be changed, but I would advise you going to the bathroom every 2 to 3 hours and changing your pad when you go. Also, you should use a Perform Pericare with a squeeze bottle, warm water. It feels amazing. Make sure you wash your hands after each use. Some blood clots may appear in your pad, but that's normal as long as they're small. As long as they're small and they're like not like huge. As long as they're like this and not like this. If they're anything bigger than a nickel and a dime, if they're like egg size, then you want to report it. You want to call your nurse. You want to call your doctor. You didn't have an episiotomy, did you? Okay, no? All right, so no episiotomy. Episiotomies are actually not that common. If you have a laceration, then you should be assessed. I'm going to see if you do have a laceration. Okay? Upon inspection, it appears that you don't have any tears, which is awesome. Which is rare after a precipitous birth. Yeah, if you was to have a tear, then it would need to be repaired. There's no redness, no swelling, no drainage, no approximation needed because you didn't tear. Okay, so I am now going to check your legs I'm going to put this blanket back over you and I'm going to support you behind the knee. And I'm going to dorsiflex it back. Okay. And is there any pain in your legs or tenderness in your calf? No? Okay. Okay. How about that leg? No? Okay. If you were to have said yes, that can indicate a positive homing sign. We have to be careful and monitor you to make sure that you don't get DVT, which is a deep vein thrombosis, which can cause pulmonary embolism, which are very dangerous. Your pedal pulses on your feet feel good. There is no edema. No signs of DVT. Pedal pulses are great. And now I am just going to look you over. The baby's back from the nursery. Would you like to hold your baby? Okay. Good job. Okay.
Mommy! Where's Mommy? Go to the apartment!
Oh no. Okay. So, Mom sees, normally we would do this by observation, but just for the sake of speaking, and let you guys know what I'm doing, Mom seems happy. She is very excited to have a newborn. She is in a moderate amount of pain. She's tired, but she's very interested in spending time with her baby. She is holding her baby. She is calling her baby Ari. They decided to name the baby Ari Marie. Mom is acting very excited and telling me about the nursery that she planned for her daughter. Overall, they are very excited to be having their first child. Yes, Mom is in the stage where she is taking hold. So she skipped the taking in part and focusing on herself, and she went right to the taking hold, which is taking care and caring for the baby and worrying exclusively about baby's needs. Overall, Mom seems very healthy. There is nothing of major concern to me, and her and baby are doing quite well.